Thanks for joining all of you who are on now, and we'll get started in a few minutes. We're just waiting for more people to join. Okay, it's 7:02, so let's get started. Welcome to the first in our series on youth mental health in the era of COVID, tonight on adolescence. This program is a part of the Fund Healthcare, Not Warfare campaign of Mass Peace Action. 778, remember that number. Mass Peace Action, an affiliate of National Peace Action, is a nonpartisan, nonprofit organization. We work to promote human rights and global cooperation, seek an end to war and the spread of nuclear weapons, and support budget priorities that redirect excessive military spending to meeting human and environmental needs of our communities. The Fund Healthcare, Not Warfare campaign, initiated in March 2020 in response to the COVID-19 pandemic, has brought together advocates from diverse impacted constituencies, learning from each other, all in this coalition agreeing that the bloated Pentagon budget takes away needed money from needed resources. The 778, that's $778 billion just passed for the Pentagon budget for this coming year, $8 trillion over the next 10 years. Just think of what we could be funding instead. Real national security means investing in the real needs of people and planet, on the health, the mental health of our children and families. It's with great pleasure that I introduce Zoe Stevenson, who will moderate tonight's program. Zoe is a third-year environmental studies major at Northeastern University and a legislative intern here at Mass Peace Action. She primarily works with the Peace and Climate and Fund Healthcare, Not Warfare working groups. Zoe, take it from here.
Thank you, Susan. Like she just said, my name is Zoe. I use she, her pronouns, and I'll be moderating this webinar for us all tonight. So she introduced this program a little bit. It is going to be the first in a series of webinars that discuss the issue of youth mental health in various ways. This webinar will also have a focus on LGBTQ+ concerns, which we know especially impact adolescents, and adolescents are the focus of this program. The upcoming webinars that will follow this one include preschool, a preschool focus, so birth to approximately age 5, a school age focus, and then a general overview to wrap it up. This webinar will be recorded, so if you know someone that wants to be here but can't, do not be concerned. It will be sent out to all who registered. And this webinar will consist of a panel discussion of our wonderful guests, followed by a Q&A session. So if you do have a question, you can either enter it into the chat or you can wait until the Q&A and raise your virtual hand, and we will call on you to ask your question. This event is co-sponsored by the Women's Health Institute, the Waterloo Workshop, the Children's Mental Health Campaign, and the Parent Professional Advocacy League, which is we know as PAL. As sort of a warning, we are a little bit short on time for the amount of speakers we have. So if you see me cutting off the speakers, please no one be offended, just trying to be respectful of all of our time. So with that in mind, I'm going to introduce our very first speaker, Dr. David Murski. Dr. Murski has served over 50 years in the working with mental health and teaching. He's the former medical director of the now closed UMass Adolescents Unit in the Westboro State Hospital, and currently he is a consultant for Riverside Community Care's Life Teen Skills Program, and he is also part of the community outreach team at the Italian Home for Children. So can't wait to hear what you have to share, Dr. Murski.
Hi, everybody. I'm an echo here. Is that I'm echoing, and it's a little bit difficult. Can you turn off this? All right. Can you hear me now? All right.
That's better.
First of all, let's do a quick overview of the basic psychological tasks of adolescent. And I'd like to immediately start with three non-synonyms that are often used interchangeably. And the three words are puberty, teenage, and adolescence. Puberty is a discussion of biological maturation. And these days, that may happen anytime between the ages of 8 and 16, 17, 18, or 19. Unhappy the person for whom it doesn't happen until 19, and perhaps unhappy the young woman for whom that happens at age 8, for which she's probably not been in any way psychologically prepared. The second term, teenage, obviously speaks for itself, a chronological term, meaning ages 13 to 19. It does not follow, however, that puberty has occurred during that period of time, as I just noted, much less have the tasks of adolescence been addressed. And those are certain psychological, developmental tasks, some of which will last well past the teen years. And I'd like to clarify exactly what those are from the point of view of psychiatric understanding. The first major task of adolescence is the definitive separation and individuation of the individual. The first major contribution in that direction happens at about age 2 or 3, when the child learns to be separate, and what separateness means, largely with the exercise of the word no. Saying, I'm somebody separate, I'm somebody different, I have my own opinions. Peter Blos, the famous psychiatrist, talked about the definitive separation and individuation taking place during adolescence. What else are the tasks of adolescence? The defining of oneself, that is, really, who am I? Which has to do with experimenting a lot with other role models, idealizing others, all in the quest of finding out who or what will I be. I may be separate and an individual, but who am I? And the third major task we talk about is the task of establishing intimacy with the significant other. In other words, the beginning of rehearsals for life commitments, finding the partner. What can go wrong? Well, there are many obstacles. First of all, someone may be born with various biological limitations. There are the issues of neurodiversity, the more politically correct word for talking about people on the autism spectrum. Another term for that that's being increasingly used is neurodivergence. Other inherited vulnerabilities or impairments, and the environmental factors that can interfere. Family dysfunction that may be expressed in abuse, the various societal problems that impinge upon the family, and the trauma of poverty, of racism, of homophobia, and the general category of injustice towards the other being characterized as anybody not of one's race or gender or nationality. And of course, we're seeing dramatic evidence of that in so many aspects of our life currently. Well, currently, COVID is worsening just about everything above that I've noted and slowing down the process. This has been increasingly studied in the last year or so. And one paper that came out just this week talked about the fact that amongst teenagers around the world, anxiety and depression has increased by at least 50% in terms of the measurements that are used. There are, of course, dramatically impaired access to needed supports as a result of the plague-caused limitations. And as a result, Adolescents with mental health problems, adolescents with special needs, adolescents with neurodiversity are having increasing difficulty in getting the services, which were indeed for some years now increasingly difficult to have access to. This is prior to the COVID crisis. Some demonstrations of that and some examples of that, well, I'll show you a picture that was in the Boston Globe just this week. This is a picture of a teenager who had been for 4.5 weeks in a boarding situation at Children's Hospital in Boston. Boarding is the somewhat polite term for somebody coming into the hospital who has been referred or brought by the police or by an unhappy family because of unmanageable behavior or the risk of serious self-harm. And there is no mental health facility to send them to. So in the general hospital emergency room, they remain as boarders. It should be noted that being a boarder, and this again, a paper came out just this week describing this in terms of a survey of hospitals around the country, being a boarder does not mean you're a patient. You are essentially in space reserved for somebody waiting to go somewhere else. In Children's Hospital, that involves going into an isolation room on one of the medical or surgical units of the hospital. And there, the child is in effect in solitary confinement with a television set, a locked door, and somebody outside of the room making sure they don't harm themselves, with a visitor occasionally just to check on them. But these people are not conceived of as patients in the hospitals in which they are boarding. So apart from whatever medications they may come with, no treatments are initiated. And in effect, they are bereft of treatment during this period of time. There are long waiting lists everywhere in the Commonwealth for any kind of care, and this is aggravated by the fact that now many practitioners will not accept insurance because insurance reimbursement has been so impaired and uneven for mental health intervention, so that in effect, even if a therapist was available, it's very likely that a family, certainly of more straitened circumstances, will not be able to get care because they can't afford that private pay arrangement. That's a quick and dirty overview, and I'll be happy to answer any discussions later on in terms of the impact of the current crisis on teenagers and adolescents in our community. Thanks.
Thank you so much, Dr. Murski, for giving us an overview of adolescent development and mental health issues, and also current problems in accessing mental health care for these populations. So now I'm going to introduce some representatives from Youth Move Massachusetts who are going to share their personal stories as it applies to mental health. The first is Dev Kaplan, who uses his story to crush stigma about mental health, which we all know exists in our world today. He acts as a beacon of hope for this community, and his message is that mental health warriors can live good lives despite what they or we have been through. Also representing Youth Move Massachusetts is Princess. She's a 15-year-old high school student, and they're also a public speaker and poet. So if you both would be willing to introduce Youth Move Mass as well as telling your stories, that would be wonderful.
Thank you. Thank you so much for having me in, Princess. I'm just so excited to be here. I might as well just get right into this. So my name is Dev Kaplan. I work for Youth Move Mass. I live in Wayland, Mass. And in the last year, I've talked to over 25 young adults through Youth Move Massachusetts. First, I'm going to share a little bit about my own experience with COVID in my own life. As a 25-year-old living with an absolutely managed diagnosis of schizophrenia, I look at the era of COVID as something that has helped me. This is a rare situation, because the usual responses of people in the era of COVID have been obviously resoundingly negative. I've personally thrived in remote learning because specifically one of my classes, directing, the workload became significantly easier. I did not have to memorize a 10-minute scene in my directing class. Lighting my workloads during a tough school year had not surprisingly helped my mental health. We all know that school can be often overwhelming. Lastly, for myself, I was able to stay very busy, like practicing my performing arts, and increasing my skills and getting my amazing job in the mental health field. Youth Move Massachusetts has been a blessing, nonetheless. By luck, I was able to survive virtually unscathed by this terrible coronavirus. So that's my perspective. Now, I was able to have 2 young adults answer some questions around how COVID has worked for them in their school setting. One of the people I supported, he feels like COVID made school a little harder and worse because it was different to switch to online learning and having to wear a mask in school. He liked remote learning, however, because it meant he could sleep in, but it also made school worse because he realizes some wouldn't have the help that they really need for school. One of the girls that I support, her opinion on school stays the same. School is tiring remotely or in person, but she says her teachers taught better online, even though they complained about it. And that shouldn't happen, teachers complaining about that. She also said that her online class bonded more than they did in person. She believes remote schooling has its positives and negatives. For example, socially, some people felt comfortable with the schooling because they could just type in what they had to say, but unfortunately being comfortable online made them withdrawn in person. Another subject is grades. Remote schooling made a lot of people extremely lazy. When the teachers assign work, they'll procrastinate with the work with thoughts like, I can just look the answers up later. Then they'll forget and have a lot of missing work that'll make their grades fall drastically. And that habit still affects many, even though we've gone back to in-person schooling. The loss of her school community on the general era of COVID doesn't have much of a hard effect on her. She's one of those people who are like, this is another event in history. It hit us pretty hard, but we're going to recover from it and try to make the best out of it moving forward. Thank you.
Hello, everyone. I'm Princess Charleston Jacobs. I'm 15. I attend Cathedral and I work with Youth Move. And today I'm here to tell you about my story, most importantly, my mental health during COVID. So in the beginning of COVID, I was dealing with the death of my father. And throughout COVID, I wasn't able to seek counseling or therapy throughout the entire 2 years of it. And then also not being able to attend school to seek counseling that we do have at school was hard because we were online. Now, with dealing with the death, not everyone's family is necessarily affectionate or talks about it. Especially with it being during COVID and like locked in the house, it was different not having my dad around and seeing my mom in an emotional state. And then forcing myself to get up and go on to online school was extremely hard considering it's not motivating. And I'm more of a hands-on learner. As we all know, everyone learns a little bit differently, and being forced online wasn't the easiest. Along with that, it was my freshman year of high school, so I wasn't really able to make friends or experience my first year of homecoming, being in the hallways, having my own locker. Like, it was really hard. And then not being able to meet my teachers in real life. It was a tad bit frustrating and almost traumatizing that I had to come in and like I was expected to know everything. And I didn't really have the knowledge that I needed to enter sophomore year. However, I did make it. And it's a little bit harder now, but I'm glad that I did get through it. It was an obstacle. And then dealing with my mom working in the hospital, it was hard knowing whether or not she was going to get COVID because she did work with COVID patients, and I do deal with sickle cell and scoliosis. So it wouldn't be good for my immune system, and I wasn't able to go into the doctors for my follow-ups. So it did become hard having to isolate myself and then having my entire identity packed away in my room with me and not being able to like go out and explore the world or make friends. And everything was literally through my phone or laptop. And aside from that, now I do have COVID and I'm dealing with it by myself, which it's really depressing because not only am I isolated from school, but I'm also isolated from my family. So it's just me. And I do a lot of after school and extracurriculars that I'm not able to join in with. And now I don't even have access to Zoom because a lot of our work is just being put onto Google Classroom. So It's very hard being by myself, and it's very sad, but I'm getting through it. And the most that I can say about my mental health during COVID was not only was it bad because I did have to deal with depression, but also I learned how to get through it. So I think that was most important. Thank you.
Thank you so much. I think it adds a lot to this kind of program to hear some personal stories from the community. So thank you so much, both of you. We're going to go a bit out of our intended order next because we do have Senator Julian Cyr with us here tonight to share a legislative perspective, and he does have another pressing commitment. So I will introduce Senator Cyr next. Senator Cyr serves in the Massachusetts Senate, representing Cape Cod, Martha's Vineyard, and Nantucket. He is the Senate Assistant Majority Whip, Chair of the Joint Committee on Mental Health, Substance Use, and Recovery, the Vice Chair of the Joint Committee on Racial Equity, Civil Rights, and Inclusion, and the Vice Chair of the Joint Committee on Elder Affairs. He also serves on committees with oversights of healthcare policy, public health, telecommunications, and energy, COVID-19 emergency management, and redistricting. So very broad scope there. Excited to hear this legislative perspective. Senator Cyr.
Thanks, Zoe, for the warm update. My name is Julian Cyr. I use he, him pronouns, and I've been serving in the Senate for 5 years now. I'm among one of the youngest senators. I've been working on these issues, not only in my time in the legislature, but prior to joining the legislature, worked in public health, was one of the folks who led the LGBT Youth Commission. I identify as queer myself. So these issues are near and dear to my heart, not just from a policy perspective. Too many people in Massachusetts struggle to access the mental health care services they need and deserve, especially when they need it. And that's especially true of young people, particularly young queer people. And what is, I think, fortunate in this moment, where policies around mental health have always sort of taken a backseat, that the mental health has been seen as a bit of a stepchild in the broader healthcare system, that there really is right now that mental health is sort of at the tippy top of the priorities on Beacon Hill. That's for several reasons. I think first and foremost, all of us have been going through this pandemic, and I think have a renewed appreciation that mental health and mental health care isn't just nice to have stuff, but is absolutely essential. And the data plays that out. I'm going to speak to that in a moment. And then also because we really have leaders in the Senate, in the legislature, in the state who are talking about their own experiences, with their own struggles with mental health. Senate President Karen Spilka, who's really prioritized these issues, speaks about her family's experience growing up with a father who had undiagnosed PTSD. I speak pretty openly about my own struggles with anxiety and depression in adolescence, and that mental health care, outpatient behavioral health services, therapy, basically helped me manage my anxiety and do things I never dreamed I could. So that is sort of the good news here, that we are working on these issues, and it's very much at the top of the agenda. But the trends that we see, particularly in young people, are really troubling. 1 in 3 high school students report persistent feelings of sadness or hopelessness. That's a 40% increase from 2009 to 2019. The most recent data is to 2019. Suicide rates and suicide ideation, but suicide rates for 10 to 24-year-olds have increased by 57% in that 2009 to 2019 period, in that decade. And the pandemic, we know, has only exacerbated this. We estimate that there are over 140,000 children in the United States who've lost either a parent or a grandparent, or who's a caregiver as a result of the pandemic. And that's particularly when you look at it from a racial equity lens. Indigenous Native children are losing family members at 4 times the rate of their white peers, and Black and Hispanic children are losing caregivers at 2.5% the rate. So we're really seeing, particularly in this generation, a real avalanche of and a real mounting of a mental health crisis. And we know, particularly when it relates to LGBTQ+ youth, that they are more likely to have a number of challenges with mental health. And so this is why, in part, why we're so focused in the legislature on addressing these issues. We actually took up and passed before the holiday break in the Senate, the Mental Health ABC Act. This is a pretty comprehensive approach to really transforming our mental health care system. You heard earlier, the speaker referred to the emergency department boarding crisis, the ED boarding crisis. This is something that is pretty unacceptable. We have hundreds of people right now in Massachusetts who are sitting in an emergency department waiting for a bed, especially a number of young people, of children. We established we took steps to establish an online portal to actually have a 21st century way of locating the beds. The way the beds are located right now is pretty old school, to use the technical term. We established a panel, particularly around complex cases for children who maybe are either justice involved youth or youth around the foster care system. And we require every emergency department in the state to have a behavioral health provider 24/7. If you were presenting in cardiac arrest, the emergency department wouldn't say, oh, the cardiac specialist doesn't sort of arrive until 8 a.m. It's 2 right now. Why don't you hang tight? That's what we do with mental health. The bill includes a number of other main provisions. A core tenet of the reforms is we mandate coverage for an annual mental health wellness exam because we feel that a person's mental health is just as important as their physical health. The bill enforces mental health parity laws. These are laws that are actually already on the books that require health insurance to cover mental health services, just like they do physical healthcare services. That has not happened, and we sort of are tightening the screws on enforcement. We take a real look at cultural competency here. We feel that it's absolutely essential when patients and providers can build trusting relationships. We know that there's there's better outcomes there. That's particularly true for queer folks, for people of color. We estimate that about 90% of the workforce of mental health clinicians in the state is white. If that's not what our state looks like, if you need a provider with non-English language skills, like Spanish language skills, particularly in the pediatric space, there's only a handful of those providers. So lots of challenges there that we're trying to deal with, and really trying to take the stories you heard from Princess and Dev and the other speakers you'll hear from tonight, and really apply that to policy. So lots of work. Certainly, we've really sort of ignored and not sort of focused on these mental health reforms for quite some time. So I want to be honest, it's going to take more than one bill, more than one session to get this right. But you really should be encouraged that this is at the top of the agenda in the legislature. The Senate has already taken action here. I'm optimistic that the House will too, and we'll get a bill to the governor's desk before the end of the legislative session. So it's an honor to be with all you folks today, this evening. I apologize for having to dash to another virtual event, but I guess in this virtual world, it does make these things possible. And really thanks to Peace Action for pulling this together and for starting this series focused on mental health. Thank you.
Thank you, Senator Cyr, for joining us. We are sad to see you go early, but we appreciate you taking the time. And it is, of course, so valuable to hear that policy perspective. So getting back on track a little bit with the original plan, I am going to introduce Keegan Miller, who represents the Trevor Project. Keegan is the advocacy manager for the Trevor Project, which means they're responsible for the research, advocacy, and legislative agenda for the Trevor Project in the areas of school suicide prevention policy and also the day-to-day operations of the advocacy team. They've also previously served as a special education teacher for Cincinnati Public Schools, so some varied experience there. And we're very excited to hear the sort of LGBTQ specific perspective that we've sort of alluded to thus far. Now we actually get to hear it. So Keegan Miller.
Thank you, Zoe. So first of all, for those of you that may not be aware, the Trevor Project is the world's largest suicide prevention and crisis intervention organization for lesbian, gay, bisexual, transgender, queer, and questioning young people. We work to save young lives by providing free and confidential crisis services via our 24/7 phone lifeline, chat, and text. In addition to that, we operate Trevor Space, which is the largest safe space social networking site for LGBTQ youth. as well as innovative education, research, and advocacy programs. So we do a lot to make sure our LGBTQ young people are supported in times of crisis, but also that they get support outside of those times so that maybe we can prevent them being in crisis to begin with. So as we've talked through a lot about mental health tonight, and coming from a suicide prevention organization, we want to I'll focus a little bit on that side of it, and why it's an issue. So we know suicide is preventable, but it's becoming a larger public health problem in the United States. From 1999 to 2018, the suicide rate has increased by 35%. And it's the 10th leading cause of death for all ages in the US, but for young people ages 10 to 34, it's the second leading cause of death. And by the way, that 10 to 14 range has jumped up. It used to be in the third leading cause, and now it's the second because it's increased by that significant of amount. And for LGBTQ youth, this issue is even greater. LGBTQ youth report attempting suicide at more than 4 times the rate of their non-LGBTQ peers. In our national survey of nearly 35,000 LGBTQ youth ages 13 to 24, it showed that 42% of LGBTQ youth seriously considered attempting suicide in the previous year, including more than half of trans and non-binary youth. But it's not just suicide, it's also the rest of mental health that we're concerned about. On that same survey, 72% of LGBTQ youth reported symptoms of generalized anxiety. 62% showed symptoms of major depressive disorder. And to top it all off, it's not that, these folks are showing these mental health signs, but they don't know it. They know it and they want help. 48% of our LGBTQ youth reported they wanted counseling from a mental health professional, but were unable to receive it in the past year. Now, unable to receive it could mean a lot of things, and I'll get into that a little bit later on the problems and barriers that exist. But 48% of young people recognize that they want that help and assistance and just can't access it for a variety of reasons. That's what we need to be addressing. And COVID has just exacerbated these issues, right? So on that same exact survey, 70% of our young people stated that their mental health was poor most or always during COVID. And 80% of LGBTQ youth stated that COVID made their living situation more stressful. In fact, in addition to that, we asked about affirming spaces, and only 1 in 3 LGBTQ youth found their home to be LGBTQ affirming. So if you can imagine in a pandemic situation where we're stuck at home a little bit more, only 1 in 3 of our young people feeling like LGBTQ young people feeling like they're affirmed in that space. That is way too many LGBTQ youth who aren't finding themselves in supportive environments. So that's definitely going to exacerbate the mental health issues that we're facing. So amongst that backdrop, we also know that there's a variety of other issues that impact mental health, everything from various economic issues to discrimination and other things. So we know that 30% of the youth reported experiencing food insecurity. 75% of our LGBTQ youth reported they had experienced discrimination based on their sexual orientation or gender identity. And 13% of our LGBTQ young people have reported being subjected to conversion therapy. So, and for those that don't know, conversion therapy is a dangerous and discredited practice of trying to change someone's sexual orientation or gender identity. Doesn't work. It does more harm than anything. But I want to point out that our young people are resilient, and when they're given the supports they deserve, they can thrive. Our survey also found that trans and non-binary youth who reported having their pronouns respected by all the people that were in their community attempted suicide at half the rate of those who did not have their pronouns respected. They also trans and non-binary youth who were able to change their name and gender marker on legal documents, such as driver's licenses and birth certificates, reported lower rates of attempting suicide. If they had access to spaces that affirmed their sexual orientation or gender identity, they reported lower rates of attempting suicide. And on our 2019 survey, we showed that LGBTQ youth who reported having at least one accepting adult were 40% less likely to report a suicide attempt in the past year. So all of these things, right? Pronouns, being able to change documents, being able to access care, being able to be affirmed in one's own identity, are positive ways that we can impact these mental health issues that our LGBTQ young people are facing. So, I really want to focus us in on, what things can we change? Well, there's a bunch of systematic changes that we can make. The senator mentioned several of those. There's comments about data collection, particularly in the time of COVID. We don't know how COVID is actually impacting suicide rates and how COVID is impacting LGBTQ people in particular, because we're not collecting data on sexual orientation and gender identity. So many surveys leave off that important demographic data or don't ask gender identity in a way that makes sense. We ask for someone's sex or gender really meaning the same thing, which it's not. And so we're not collecting, how many of these folks are trans or non-binary. So we don't know the extent of the issue. And if you don't know the extent of an issue, it's really hard to get funding to provide supports for the issue. It's really hard to see if you're, moving that lever in the right direction towards having more people supported in their mental health. So we really need to be collecting that data. In addition, we're in this kind of sometimes virtual, sometimes hybrid, sometimes in-person space, but our schools need a lot of support around mental health and suicide prevention, but that's kind of being attacked right now across the country via social emotional learning, where we've made a lot of progress in the last decade on incorporating mental health and social emotional learning in schools. Now there are folks coming to school boards and asking for that to be removed, which is just going to exacerbate the issue further. And then, of course, access to care. So we want to look at making sure that our LGBTQ young people have that access, making sure there's parity, making sure there's access to telemedicine, even in post-pandemic times, years from now, we want still people to be able to access it in that way. We want to make sure that insurance is covering it and that our LGBTQ young people have access to that, no matter what their barriers to gaining insurance are. So there's a lot of things to do, a lot of barriers out there, but our youth are resilient. They can push through and they can get the help they need when we make sure that they get those supports.
Thank you, Keegan. So now we've heard from all of our speakers, heard some personal perspectives, an overview, heard the LGBTQ specific perspective, and now we're going to open up to the audience for a Q&A. And to do that, I'm going to pass the floor over to Andrew. Andrew is a third-year Northeastern student as well, a business and design student, and also a media intern here at MAPA. So if you've seen any of our brand new shiny logos or anything like that, that is all Andrew's work. So I'll hand you into their capable hands for the Q&A.
Hello everyone, I'm Andrew. I use they them pronouns. So yeah, we're gonna start the Q&A. Feel free to put any questions in the chat or raise your hand and we can call on you. So yeah, we'd love to hear your voices or questions. So yeah, let's get started. And if there are no questions, I will start. So, all right, Asma, go for it. That's how I'm pronouncing it correctly.
Hi, my name is Asma. I'm one of the physicians in Cambridge area. And first of all, it's an amazing program, Zoe. Thank you for putting this together. I'm kind of disheartened, but at the same time amazed to see how resilient the younger population is, having going through such an intense time that of the century, essentially. I deal with patients who are on the other spectrum. Essentially, they are all 65 years or older and they reside in nursing homes. And I see so much devastation or have been seeing so much devastation in the last 2.5 years. This will be the third winter going into a pandemic, so you can imagine. But hats off to the youth for putting up with so much and still having such a positive and great attitude about it. It was interesting to hear Senator's comments about the changes that are going to come into the legislation with so much of pandemic's effect on the youth. So it is quite heartening to see that, because we don't have that support yet for elderly. So it would be nice to see that the youth can get that kind of support and get some benefit from it. So thank you. That was just more of a comment than a question.
Great points though. Like, I feel like anyone who's on the ends of our society, whether it be youth or elderly, they don't get as much attention as they should. So great points, great points.
I have my
Elaine,
hand
go for
up.
it. Yeah, go for it.
Okay. Well, like a lot of people, especially those of us on the older side, it's been quite a period of time for all of us. What I'd just like to say is congratulations for all of you who have jumped in and gotten involved with this at this point. Because, especially the young people now, we're counting on you. I've been in the struggle now. I came out as a lesbian back in 1968. And it was still officially listed as a mental illness back then. Did y'all know that? It wasn't that long ago. That didn't change until 1975. So now, and I was very, very pleased and appreciate that you did include some of the issues about people who, young people who have disabilities already, and then having to deal with COVID on top of that. That is a huge area, because young people that required some kind of assistance in going to school then lost any of that assistance by having to do everything at home. Plus the families ended up, well, anyway, it's just been horrible for anybody who already had a disability or who has acquired a disability through this whole process. So what I encourage everyone to do is to realize that what we need to do is to create circles of support around ourselves and each other. That is the most positive thing we can do to move forward. And just so you know, I'm sitting here in my wheelchair, and I'm very much in support of this. I was involved in getting the Americans with Disabilities Act passed over 31 years ago now. And I've been arrested 27 times so far. Probably will do a few more if I get a chance to. So I'm encouraging you to take heart and stay positive and find those things that you can do. What's the next good thing you can do, and the next good thing you can do? And also remember, self-care is a sacred thing. We have to take care of ourselves so we can be here to take care of others. So I just salute all of you.
Absolutely.
Proud to be part of the
Amen,
gang.
Elaine. Amen. Thank you so much for sharing that. So much important things you had to say, especially the end, self-care, finding your community, finding support within your own network can be so important, especially during these times when, you know, you're not surrounded by as much people. I know I'm the same way. I tried to find my trans community, my queer community as much as I could to kind of support me through the whole thing. So yeah, thanks for
And
sharing.
creativity will carry us forward.
Absolutely.
We have to make it up as we go along and encourage each other. In the midst of chaos, we have opportunities to create new things that will actually lift us above all the yucky.
Absolutely. I find that the queer community has a great job of doing that. We're very creative in finding ways to uplift ourselves. So it's great hearing from you, Elaine. Thank you so much. So now we're going to move on to Dawn. I think Dawn has a question. I think you're muted, Don. There we
There
go.
it goes. Okay. Yeah. How do young people, their teachers, their parents, their therapists, how do they deal with the power of social media lately that spreads? I mean, issues around suicide are huge on social media, people encouraging each other. Today, my daughter sends me something from San Francisco about a child in her school who says, I'm going to harm myself if the violence in the school on December 17th happens. There's some kind of meme going around on Instagram or TikTok. And on top of, my daughter dealing with trying to help kids with learning disabilities with online schooling because of COVID, now they're finally back in school, happy to be there. And there are all these threats. How do people deal with this?
Any of our speakers want to jump in? Yeah.
I can speak on it. I can't really say from a parent or a therapist perspective, but I can speak from my own. I know that a lot of the kids, especially in my generation, a lot of them, they use these things as jokes, but they don't realize how harmful it could actually be to someone. They're kind of ignorant to that. And I think a lot of the time, it's not really overlooked by a lot of adults, but a lot of them actually don't know. So unless it's really brought up to a school or a parent specifically, it's something that's not really going to be dealt with. And I think that a lot of the things happening now, we need unity to get over it. And unless people really do speak up about it and draw the attention to it, then it's never going to change. But from my perspective, I can say that it is scary to have someone tell you to harm yourself or make a joke about it, especially if you don't know what that person's going through.
Yeah. Thank you. Thank you very much. The social media thing is just frightening because it can magnify so many ideas, positive ones too, but unfortunately negative ones. And it must be a real challenge for parents and for all of you young people to deal with that.
I think one of the other things too, if I can add to what Princess, that was a beautiful statement. It is overwhelming for everyone, parents, students, teachers alike. And I think for the generations that haven't grown up with that social media culture, it's a lot more difficult to understand what's happening and how it's how exponential the problem gets really quickly. And so I think having really frank conversations about that with the youth supporting adults in that space is really important to talk about. Well, what do you do if your child is visiting these things? If you're a teacher, what are your resources to make sure your students are getting supports? If there was all of the viral things going around about doing things at school or to teachers, or there was a bunch of stuff like that. And schools really quickly had to realize that they needed to be monitoring social media in a lot different way. But it was just a conversation that no one ever had, right? And so part of it is just like learning and being open to figuring out how some of these things work, figuring out how to support the young people who are involved, and then also then putting out positive on the other side of it, right? Is can you make things go viral that are going to put good into the world? Let's do that. So that, but as a society, we don't like to talk about any of this. We don't like to talk about mental health. We don't like to talk about suicide prevention. We don't like to talk about the fact that there are those websites out there. I mean, the New York Times literally just put out an article earlier last week on, it was on a specific website, but they were talking more broadly about websites that encourage folks to think more in depth about suicide and how that process that and all of that. And so it's out there and we need to talk about it. But if we're not going to talk about it from a mental health perspective, or we're not going to talk about it from a prevention perspective, then people are going to talk about it from that way. And so, modeling that behavior and modeling the good behavior side is, I think, important.
Exactly. Thank you. Thank you. Thank you both.
Thank you so much for that. Sandy, go for it.
Yeah, thanks, Andrew. I just want to say that as a retired bedside nurse for many years, I've been retired for about 10 years now, I can certainly testify to the horrendous situation, at least in the institutional level, of folks in crisis, including younger folks, stuck, bunked in an emergency room, back room for days and longer. And I want to look at resource allocation. The fact that hospital systems around the state have been closing down mental health facilities that are good for short-term or longer-term care at a time before COVID, before this particular pandemic. I mean, going back since the economic crisis of 2008 or whatever, with increased anxieties and family disruptions and so forth going on. So so actually, I had a specific question in mind for Senator Cyr. He wasn't able to stay, unfortunately, but I'll throw the idea out anyway. We've been talking about parity between physical and mental illness and how we approach it and treat it. But in terms of resources, there are a couple of things. The billions of dollars that are coming into the state, for example, can we say how those are allocated? Is it fair to say that we're building up our infrastructure to help folks in institutions, in clinics, support clinicians in the community that are needed? Are we as a society pointing in the right direction? And it goes, I think, a lot further than an individual or a specific piece of legislation. It's an overall how we set our priorities. And actually, somebody has told me that a budget. Now look at a society's budget, and that'll tell you what our priorities are. So I'm just wondering if we can get our budget to reflect that. Anybody else want to comment on that? Because I know Senator Cyr isn't here.
I think we have a really unique opportunity right now with 988 starting to, we'll be starting in July as a 3-digit number that will essentially connect to the national lifeline or the local state lines, depending on how it ends up getting set up state by state. We have this opportunity to message in a way that starts to make that shift and change that you're talking about. So many times with the national lifeline, the messages that people have gotten, whether it was the messages that were given or not, I think the message that people have gotten is like, you have to be you have to be suicidal to call the national lifeline, right? Like that's the message that people get, but that's not the case, right? You can call it if you're having a bad day and just need someone to talk to, like that's a possibility. And so that like very first line of crisis support, of getting on a phone or getting on a chat or text and talking to someone, has been limited by our societal perspective of what crisis actually is. And I think with this shift, making it easier to access, giving it a 3-digit number, it is going to help in a lot of ways because it's a 3-digit number. It's easy to remember and call, cool. But also it allows us the opportunity to rebrand and remessage and remind people that they can reach out for help at any point in time. They don't have to be immediately suicidal to do that. And then while we're doing that and having that conversation, we also can build up the supports and structures underneath to make sure that people are being supported and don't land in crisis, or when they are in crisis, that they get supports that aren't police officers showing up at their door and exacerbating the issue. And so, it's a 1-2 punch, I think, at this point, is we can start to have that conversation and that shift while we talk about this easier access to crisis services, at the same time putting that budget into place, putting those infrastructure into place to make sure that people are getting care.
May I?
Of course, yeah.
I've been in the Commonwealth long enough to see essentially the destruction of what was a relatively good public mental health system. There was a period of time when there were state clinics in almost every community in Massachusetts, in which the state paid for the professional staff, psychiatrists, psychologists, social workers, et cetera. They didn't pay for the secretaries. That the community had to provide, as well as the rental space. However, all of that fell apart quite cynically, in effect, when two things happened. One, the insurance companies were forced by legislation to provide, $500 a year for mental health coverage, at which point the state withdrew from providing these public services. The second thing, the definitive nail in the coffin, was the Community Mental Health Centers program from the federal government, which promised to provide all kinds of community-based services, which inspired the state and all the other states as well to close the mental hospitals, the asylums. And I like to stress that that word asylum has two meanings. It's not just a place to lock up the crazies. It's also a place to provide protection for those who needed it from the negative forces of society around them. The mental hospitals were closed because now there were going to be public programs in the community to provide a more humane environment for all those patients. Well, it never happened. In fact, largely sabotaged by the Reagan regime, because it was a Johnson Kennedy idea, which was killed. So that in effect, we had what has led to the current state of affairs, where vast numbers of homeless around the country, who are primarily mental patients, the people that you're seeing at Harvard Square or Downtown Crossing and so on, are primarily psychiatric patients who are not getting the care they should be getting. So that's part of the history which now people are working to try to repair. I should note, however, with all the positive noises coming from the senator, a great deal of what he was describing has to do with setting up programs that will improve training, will fund longer term commitments from people that will now come into the field, that the state will help to educate and so forth. This is a long-term program. It's admirable, but it's not providing a great deal, in fact, not much at all, of direct funding to current programs needing that funding and needing to improve salaries appropriately enough so the patients can get care from people who are adequately trained. Those people are not coming into the field or are leaving the field or are going into private pay arrangements and leaving the public sector facilities, such as the ones that I've been involved with for the last 50 years. So it's a positive note, but I'm not jumping up and down with enthusiasm about it, because in effect, it's really a very, very small contribution to a very large need at this particular time. I don't know if that's a helpful answer to you, Sandy, but I think it's where the situation is right now from my point of view.
It's a jumping off point where we need to build on. And I think our whole broad peace and justice movement needs to work together on it.
Amazing. Thank you both for those thoughtful responses. I'm going to pass it back to Zoe for a few words about the program and about some resources, and we'll be able to loop back around to more questions, hopefully, after that.
Hello again, just to close up the program, as we are coming up to the hour, coming up to 8 o'clock, and we want to let you go if you want to go. I just want to say thank you to everyone who's here right now, our speakers, our co-sponsors, everyone in the audience, and also the planning team that made this happen. So Susan, Sandy, Catherine, Bonnie, Amar, Liz, Andrew, all of you, thank you so much from everyone here. Andrew is going to send some resources in the chat if you want to have some further contact with this type of material and topic going into the future. We have some national, local, and also some directly from the Trevor Project. So check those out. If you'd like to save the chat, you can do so by clicking the 3 dots in the lower right-hand corner of the chat box. If you're interested in joining the Fund Healthcare Not Warfare working group at Mass Peace Action, and specifically if you're interested in working on mental health advocacy, you can email Susan, who is here tonight. Susan, if you'd like to put your email in the chat for people, if you're comfortable, that would be wonderful. You can also check out the MAPA website for some other great webinars And stay tuned for the rest of this webinar series on youth mental health. Once again, there'll be preschool age birth to 5 and also school age and an overview. So more to come. If anyone would like to stay and ask some more questions, hear some more answers, we can stay on for a few more minutes. And I believe some of our speakers can as well. So thank you all. Have a great night if you are not staying. And we hope to see you again for future parts of this series.
Thank you. Thank you.
I know, Princess, you had a question before.
Yeah. It wasn't more of a question, it was more of a comment, but like being a youth and looking in, I think, or what I've noticed and observed as someone who writes poetry, and I do write poetry surrounding issues like this, I believe that a lot of the funding is going towards a lot of unnecessary things. Like where I'm from Dorchester, which is a small town in Boston. And I noticed that the city gives more funding to urbanizing the city. Everywhere you turn, there's a new building or apartment complex being built, and they're not funding schools, they're not funding programs. But where I'm from, the doctors will be the first person to line you up to send you to an asylum. So I believe that the funding is just all in the wrong place. And I think that's where it needs to start. There needs to be, well, I feel like we are advocating. I believe that they need to listen to where the money should go, because I think all of this, in my opinion, is unnecessary, because they're just building apartments for gentrification, and they're raising the rent and they're kicking us out. And it's just like, this is what's causing all the anxiety and the depression, not knowing if you're going to have a home in the next month. So I believe that the city needs to listen to us more.
Yes.
I absolutely agree. And I think that people kind of undermine the importance of like material resources, like proper housing, affordable housing, not being gentrified, all those things, because it's like that goes hand in hand with mental health. You can't just have, give people a therapist, give them drugs, whatever it may be, and not take into account that all these other things, like you said, gentrification, poor allocation of funds, it all can affect mental health in detrimental ways. So thank you for that.
Would it be okay if I threw in a little more?
Yeah, of course.
I'm a charter member of On and On Anonymous. I have a tendency to go on and on and on. But anyway, what I wanted to share here was that, see, yes, I'm in a wheelchair. Why? Well, over 44 years ago, on September 30th, 1977, I know before a whole lot of you were born, I was literally stabbed in the back. That's how I got my disability. This was in 1977, and I was living in Atlanta, Georgia, and I was out as a lesbian, but I was involved in an organization supporting prisoners and their families in Atlanta, Georgia. Yes, interracial. And there was nothing. And I had to, my only choice, I was accepted into Georgia State University, graduate school, but I needed accessible housing and transportation. Guess where I got to live for a whole year? On the grounds of the Georgia Mental Health Institute. I was in Unit 6. It was called the Vocational Rehabilitation Spinal Cord Residence. Yeah, we were Unit 6. And I was 28, and I'm on the grounds of a mental hospital with a curfew. And I didn't have a key or a lock on the inside of my door. I had to get a staff member to open my door, and I had a curfew. I lived on the grounds of a mental hospital for a year. But you know what? I survived it, and I learned a lot. So whatever you're going through right now, and believe me, I know, because for a lot of us, this is no joke. This has been a couple of years of pure hell for a lot of us. And a lot of us haven't made it. And a lot of people they might still be breathing, but they're not alive. So how do we survive this? The way to do it is inside of us. You will find a way. Listen to yourself. And if you get in trouble, reach out. Don't be afraid to ask for help. But be
Totally.
careful who you ask.
Yep, absolutely. It's
Anyway,
part.
I've said enough now, but I'm just saying, we can do this. We can do this. And I'm counting on you young people. You have a lot more energy than I do anymore. I'd poop out real fast.
That's all right. You did your part. You did your part. But absolutely, part inside and part knowing when to reach out for help. I think those two coupled together really can make the biggest difference for sure. So absolutely. Any other questions? We have a few more minutes.
We have run over enough for everyone's liking. We can just say goodnight and thank you again to everyone for coming. We're so grateful to have you here, and check out those resources. Like we said, we'll see you for future webinars.
Thank you, Zoe. Thank you, Andrew.